Hello, my name is Dr. Baharav. I am a psychotherapist and doctor of clinical hypnosis, and today I will be discussing the topic of anxiety. Now, anxiety is basically feeling that the person is jumping out of their skin. They can feel dizzy. They'll have problems concentrating, problems with their memory. Breathing is difficult. They might feel a certain numbness or tingling in their fingers and toes. There's different levels of anxiety. Some people have the tendency to have anxiety disorders. Heightened anxiety will lead to panic attacks. So if there is a chronic level of anxiety, the person always is anxious. They might even be used to it and say, sometimes I feel relaxed. But really, when there are panic attacks, there's always a chronic level of anxiety. And as it becomes heightened, the panic attacks occur. Okay. Now, it's also important to know that the anxiety will produce symptoms often mistaken to be ADD, ADHD, because anxiety will cause problems with the memory, with the concentration, with children being able to sit still and focus. Now, what happens is, even though we have a predisposition, somebody could have a predisposition, a tendency for anxiety. Still, anxiety is basically triggered. I'll explain. In other words, somebody could have a tendency that when they are under a certain amount of pressure, anxiety will be triggered at level 5. And this is how they are. And they might be taking medicine for anxiety, and they might be taking medicine all their lives, but the medicine might be helping to a certain percentage. Except for one problem. The trigger of anxiety is constantly being produced. It's constantly being triggered. Things that are out there are triggering the anxiety, and they keep on taking medicine to try to correct that. But what we do is, by getting to the subconscious mind, and again, all treatments are made to measure according to the actual client. By getting to the subconscious mind, I work with certain elements of perception, and thereby creating in the subconscious mind a system that is basically disturbing the triggers from happening, where the person, everything they see, everything they hear, because of the treatment, their minds understand everything in a lighter way automatically, emotionally and physiologically. If I go, boo, how will the person's heartbeat, their pulse, the blood pressure? Well, it's going to be different before treatment and after treatment, because as we build them up subconsciously and their minds begin to understand everything automatically in a lighter way, not only does it become difficult to trigger that level 5, and that's how the person always was, but now the person is basically understanding things in a much lighter, easier way, besides a lot of the advantages of feeling better about themselves and more confident and social. Their minds take it lighter, making it difficult to trigger that level of anxiety, whereby it is not triggered anymore. And as it becomes easier and easier, their anxiety slowly is reduced. And this is how the person now is. Their minds are understanding things differently. The anxiety becomes more and more difficult to be triggered. And the first thing to go is the heightened anxiety, which becomes very difficult to be produced until it cannot be produced anymore, and anxiety thereby is lessened more and more and more. And also it's important to know that as the anxiety becomes a little bit better, concentration is right away elevated. And once the anxiety becomes a lot better, memory becomes better. Not that it becomes better than before, but it's restored to the potential that the person had before. Okay, and that's basically it for this topic of anxiety. My name is Dr. Baharav. I am a psychotherapist and a doctor of clinical hypnosis. Thank you.